Hello everyone, good day. I'm John Mark Acosido, a student from Our Lady of Fatima University College of Nursing. Today, I'm gonna show you the parenteral administration intradermal injection return demonstration. To start the procedure, check the MAR or the medical administration record of the patient. Check on the medication carefully against the MAR to make sure that the correct medication is being prepared. Follow the 3 checks for administering medications. Read the label on medication when it is taken from the medication cart. Second is before withdrawing the medication. And the third is after withdrawing the medication. The next procedure is we need to prepare or organize the materials needed for this intradermal injection. So the first is the PNSS solution, the act as a medication that we will be injecting to the patient. Next is the 1cc syringe, aspirating needle for withdrawing the medication from the vial, medication tray, that this is where we place all the materials that we'll be needing for our intradermal injection. Cotton balls, one is soaked with 70% solution alcohol, another is dry cotton ball. Next is a pair of clean gloves for our protection. Waste receptacles for the used syringe. And lastly, an injection pad. This is where we inject our medication. After organizing the equipment that we needed in this return demonstration, perform hand hygiene and observe other appropriate infection prevention procedures. Next is we need to prepare the medication from the ampule or vial for drug withdrawal. So, we need this 1cc syringe, the aspirating needle that will be needed for withdrawing the liquid from the vial, the medication tray, and the PNSS. So first, we need to break this one. After exposing the top part of the medication, we need to clean it with cotton ball soaked in 70% solution. We need to at least do this for 20 to 30 seconds. After that, open the 1cc syringe from the pack. Remember, we need to carefully handle the barrel, only the barrel of the syringe. And then I will remove the needle. Next is we will replace it with the aspirating needle needed for withdrawing the medication. So this is the syringe and this is the aspirating needle. After doing after changing the needle that we are using for withdrawing the liquid from the vial, we will aspirate air equivalent to the solution or medication that we are needed. So be aspirating for at least 0.5 ml. So after we aspirate needle, inject the air into the vial. And then get the amount needed for our intradermal injection. So if there's an air bubble, we need to pinch it to remove the or release some liquid to remove the air from the syringe. So like that. Okay. And then we will recap this. After we have the medication that we needed for our intradermal injection, we will remove the aspirating needle and replace it with the correct needle that we are needed for our intradermal injection. So I'll remove this aspirating needle and put back the right needle that we are needed. So here it is. Put the used aspirating needle in the waste receptacle to avoid needle prick injury. After we prepare the medication that we are needed for this procedure, we will now prepare our client. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client that the medication will produce a small wheal, or sometimes called a bleb. A wheal is a small raised area like a blister that the client will feel a slight prick as the needle enters the skin. Some medications are absorbed slowly through the capillaries into the general circulation, and the bleb will gradually disappear. Other drugs remain in the area and interact with the body tissues to produce redness and induration or hardening, which will needed to be interpreted at a particular time. This reaction will also gradually disappear. And now I'm gonna show you how to prepare the client. So it's like this. Oh, hello sir, my name is John Marosido, your student nurse. May I ask your name and your birthday? Today sir, I'm gonna perform intradermal injection, which will identify if you have any allergies for the medication that I will be injecting to you. Is that okay with you, sir? So to start the procedure, after you introduce and know the client's information, you need to provide privacy for the patient. Select and clean the site of injection. So the forearm about hands width above the wrist, and 3 to 4 finger widths below the antecubital space. So here. So this is our injection site. So avoid using sites that are tender, inflamed, or swollen, and those that have lesions. So check for swelling or lesions. And then apply gloves as indicated by agency policy. So after apply the gloves, cleanse the skin and the site using a firm circular motion, starting at the center and the widening of the circle outward. So we will use cotton ball soaked in 70% alcohol solution. So from center outward. Receptacle. Allow the area to dry thoroughly. Then prepare the syringe for injection. So remove the needle cap. While waiting for the antiseptic to dry. Inspect if there are any air bubbles on the injection, and if there is, small bubbles, you need to plunge to remove the excess air. So with your non-dominant hand, put the dry cotton ball on your 4th or 5th finger, and then grasp the syringe in your dominant hand close to the hub, holding between 2 thumb and 4 finger. Hold the needle almost parallel to the skin surface with the bevel off of the needle. So inject it into 10 to 15 degree angle, almost flat to the skin surface. So pull the skin taut so the injection or insertion of the needle is easy. After you inject the needle, inject the medication until you form a bleb, and then gently pull the needle at the same exact of insertion. Okay. Use dry cotton ball to remove the excess or spilling of medication. And remember, do not massage the area. So dispose the syringe in the receptacle container. Remove and discard gloves. Perform hand hygiene again, and then circle the injection site with the ink of white, black or blue ball pen. So area, and then state the date. Time, 2:50, and the name of the medication. Lastly, your initials. Then document all the relevant information. Record the testing material given, the time, the dosage, the route, and the site. So inform the client that the medication should last at least 30 minutes before the result of the injection.